Good day to my clinical instructor, Sir Clint, and I am Alexandra M. Abarquez from BS1D. Today, I am going to demonstrate physical assessment from head down to the neck, thorax, and lungs. But before proceeding with the assessment, assemble all the necessary equipment and supplies and explain the procedures to the clients and why it is necessary and how the client can cooperate. And also, it is important to wash your hands and observe any appropriate infection control procedures. Then provide for clients privacy and determine their history on specific assessment area. So now, let's start. So first is assessing the general appearance and mental status. So good afternoon, ma'am. I am Alexandra and I will be your student nurse for today. May I know your name, ma'am? Please? Okay. And what do you prefer to be called?
Yes.
Ma'am Mispa. So, Ma'am Mispa, today I'm going to do a physical assessment. Will it be okay for you, Ma'am Mispa? Okay, thank you so much, ma'am. And let me ask you some questions before we will proceed on the assessment. Can you tell me your date of birth?
September 27.
Okay. So, do you know where you are right now, ma'am?
Hospital.
So the client has answered all the questions correctly and will chart that as alert and oriented. Next is assessing the general behavior and attitude of the client, such as observation of overall hygiene and grooming, and relate this to the person's activity level. So far, the client is good in appearance, posture, eye contact, no bad odor, and no problem with the client's behavior, attitude, and insight. So next is collecting the client's height and weight. So ma'am, would it be okay for you to measure your height and weight? Yes, okay. So thank you so much, ma'am. So ma'am, please stand in the wall. This morning, ma'am. Okay, ma'am, so your height is 5'1". And also, ma'am, please stand inside the weighing scale. Remove your sneakers, please. Okay. Alright. Okay, so the weight of the patient is 78.65. Yes, ma'am. So, ma'am, do you have any history of smoking or drinking alcohol? Okay, that's great. And what do you do in your daily living?
Housekeeper.
Okay, ma'am. So next thing to do is observing the client's gait, standing, sitting, and walking. So ma'am Ispa, can you try to walk that way, ma'am, at your normal speed, and from there, going here, to assess the balance, okay, ma'am? Alright, good. And also, ma'am, just walk straightly using the heel of one foot directly in front of the other toe, ma'am. Going back on that stage, ma'am. Alright? Yes. Okay, that's great, ma'am. Thank you so much, ma'am Mispa. And next thing to do is letting the client stand erect and note any unsteadiness or swaying. So, ma'am, can you stand erect like that? Okay. Together with your foot, ma'am. Your hand beside on your hips. Okay, that's right. Okay, so far, I can see that it's okay for her to stand erect. So now, after assessing the general appearance and mental status, document the findings in the client's record. Ma'am, sit down again, ma'am. So next thing to do is the head and hair or skull and the face assessment. So ma'am Ispa, next thing to do is head assessment, but before that, let me ask some questions first. Have you ever been diagnosed with a medical condition related to your head, such as headache, a contusion, or a stroke, or a head injury? Okay, great job, ma'am. Have you had any symptoms such as headache? Okay, let's now start with the head assessment. Will it be okay if I touch your head and do some examination, Ma'am Mispa.
Okay.
Now, so inspecting the skull for the size and the shape and the symmetry. So, and the skull is rounded, symmetrical, and smooth skull contour. So next is palpating the skull for nodules or masses and depression. So ma'am, I'm going to palpate your skull, okay? Okay, as I can observe is that has absence of nodules or masses. The next is the hair assessment through inspection and palpation. Ma'am, I am going to do a sectional of your hair if you don't mind, ma'am. Okay, so while doing the sectional, I am looking for any lesions, lice, or any infection. I'm also looking for the evenness of growth of the scalp, hair thickness or thinness, also hair texture. Next is I'm going to check behind the ears. On the other side, ma'am. Along the hairline at the back. Okay, as a finding, the client has evenly distributed hair with long, black, and shiny hair, and there is no lesions or any infection. And now let's move on to the inspection of the facial features. As you can see, her face is symmetric, which means no drooping on the one side. And also I'm going to check the eyes for edema and hollowness. Let us see her eyes. On this side. So, and as we can see, no edema. Next is the cranial nerve 7 or the cranial nerve check. So, this is when I will note the symmetry of the client facial movement. Ma'am, can you try to elevate your eyebrows? Okay, that's good. Then please frown or lower your eyebrows. Okay, then close your eyes tightly, ma'am. So next is puff your cheeks. Okay, then smile and show your teeth. Alright, that's great, ma'am. Thank you so much, Ma'am Mispa. And so we can see a symmetrical facial movements. So after the skull and face assessment, document the finding in the client's record and then proceed to skin assessment. In order to perform a complete and accurate assessment, the nurse needs to collect data about currents and symptoms, client past history, family history, and health and lifestyle practices. So ma'am, do you have any birthmarks? No. So do you experience any change in the ability to feel pain, pressure, touch, or temperature? Okay, no. So do you have any piercings or tattoos? Okay. So you have piercings on your ears. Okay, that's great. So next is looking at the family history, because some skin conditions tend to be hereditary or contagious. Has anyone in your family, ma'am, had a recent illness, allergy, rashes, or any skin problems? Okay. So next is assessing the past health history. So do you have any allergy or skin reaction? Any history of smoking? Okay. So next is asking some question about the client's lifestyle and health practices. Are you regularly exposed to chemicals that may harm the skin? No. So any exposure to extreme temperature? No. Alright, that's great, ma'am. Thank you so much for answering my questions. So, while looking at the client's skin, now I'm going to inspect the uniformity of the skin color starting on your face, down to your neck, and back. Then let me see your both arms to check if there are some lesion and color variation. Okay. While checking the temperature back at the hands, I'm going to check the temperature of your skin. Okay, ma'am. So the skin is nice and fair from hands to also feet. Okay, while checking the skin moisture, the next, checking the skin moisture. Then noting this client's skin turgor. Ma'am, I will pinch your out just a little bit of your skin. Okay. Now I can say that the client has a very good skin turgor because it goes to previous state immediately after I pinched it. So next thing to do is palpating for edema at the feet. So to determine the extent of the pitting edema, I will push on your skin, measure the depth of the indentation, and record how long it takes for your skin to rebound back to its original position. So, ma'am, I will touch your skin and your feet. Okay, so after doing the skin assessment, document the findings and then proceed to nail assessment. Ma'am Sam, Ma'am Miss Pa, can I see your hands for your nail assessment on the other hand? I will inspect the finger blade shape, then nail texture, bed color, and tissue surrounding nails. As a finding, the client has a smooth and intact epidermis with short and thin fingernails and toenails. The next is performing glance test of capillary refill. Okay, ma'am, I will pinch this one nail. Okay. Alright, the other side now. As we can see, convex and with good capillary refill time of 2 seconds. After getting the fingernails assessment document in the client's record, now let's proceed to eye structure and visual acuity assessment. Ma'am, let me ask you some more questions to assess your eyes. Will it be okay, ma'am? Yes. Will it be okay, ma'am?
Yes.
Okay. So do you have any family history of diabetes, hypertension? Okay. So do you have any current use of eye medication? Okay. Are you using contact lenses or any eyeglasses?
No.
Okay. Are you having hygienic practices for corrective lenses? Do you have any current symptoms of eye problems such as blurring, vision, itching, or pain? No. Okay, now that's great, ma'am. So now I will inspect your eyes. Okay, I'm gonna use my As I can see, it has a fair distribution and alignment. The next is the eyelashes. It is even in distribution and direction of curve. So next is the eyelids. The pupillary fissure or the opening for the eyes between eyelids is equal in size. No lesion, crusting, redness, no swelling or bruising, and no laceration. And I will also inspect the position in relation to cornea. It is translucent and flat. Then next is inspecting the cornea for clarity and texture. So the cornea is clear, bright, and smooth surface. So ma'am, let me pull your lower lid and please look up so that I can check your bulbar conjunctiva and palpebral conjunctiva. Yeah, look up ma'am. Okay, the other side. Okay. As being observed, the bulbar conjunctiva appears mainly white and no lesion. Also, the palpebral conjunctiva appears in pink and no lesion. So, ma'am, while palpating, then ask for any pain tenderness. No, ma'am. The other side. So the next thing we're going to do is the cranial nerve 5 examination. So using a cotton and sharp thing such as cotton tip, can you please close your eyes, ma'am, and determine whether something in your face is soft or sharp? It is soft, ma'am. Can you determine? Soft. It is sharp. Soft. This one, ma'am, it is sharp. Soft. So now, next is assessing the corneal reflex. Ma'am, at this time, please keep both eyes open and look straight ahead. So I'm going to start. So next is assessing the anterior chamber through applying a tangential light on the cornea to assess whether the nurse is able to see the entire iris without shadow. As we can see, the anterior chamber is clear, and next thing is we are going to do is inspecting the client pupil. Now look distant now. Okay, straight. Also straight. So as observed, the pupils are equal in size and it's round. The pupil is also reactive to light and is accommodating. So the next is extraocular muscle test. Mom, please look straight on this pen light. Hold your head, stay still, and follow the direction of this pen light through your eyes only now. So, okay.
So ito, ibita ko kaon.
Ha?
Ibita ko birthday dito. Kaon. Ito.
Okay.
Diyan naman diya. Balik lang ko. Balik.
Hindi ka nga
Tumigo lang ko.
Very good, ma'am. So next is assessing the visual field. Ma'am, Miss Pa, please pick a target that's straight in front of you and just keep and never take off your eyes from that target. I'm going to bring an object into your visual field and I want you to point it when you see an object. Please make sure to never move your eyes. First, the item. Just point out, ma'am, where is it? Point out. Using your hand, ma'am. Point out where it is. Okay. Where is it, ma'am? Good one, ma'am. Okay. So next is assessing the visual acuity. Okay, ma'am. Please stand right here for me, ma'am. Okay, ma'am. So please stand right here, ma'am. Here, ma'am. Look at the chart over there and try to read the lowest line for me that you can read. Cover your right eye using this eye of your hand, ma'am. Right here. And read that one, ma'am.
Girl.
Okay, ma'am. And the other word, ma'am?
House.
Okay. So, ma'am, the other side na naman, ma'am. Okay. Read again, ma'am.
Girl.
And the other word, ma'am?
House.
Okay. So, this means, sit down again, ma'am. This means that the client has 20/20 vision, and this means that she can see the same line of letters at 20 feet that a person with normal vision can see at 20 feet. And after assessing the eye structure and visual acuity, document the findings, and now let's move forward to ears and hearing assessment. But before that, there are need to ask questions to the client. Check number. So, ma'am, have you had any trouble in hearing? Okay. Have you had any symptoms like draining of the ears, drainage from the ears, or or ear pain? Do you ever feel dizzy of balance or like the room is spinning? Have you ever been diagnosed with an ear condition such as infection, tetanus, or vertigo?
No.
Are you currently using any medication or ear drops or supplements for your ears? Okay. Thank you so much, ma'am. Now I am going to inspect your ear cup for colors, symmetry of size, and position. Let me see your ears, the other side. As I've observed, ears are equal in size, literally, auricle aligns with the corner of the eyes, and the color is consistent with facial color. So next is palpating the auricles. Do you feel any pain, ma'am?
No.
No? On the other side, ma'am. Okay. So as I find it, the skin is smooth with no lesion, lumps, or fluid. Next thing to do is using an otoscope. So to inspect the external ear canal and the tympanic membrane.
Ayun, hindi naman yan.
So ma'am, let me check your ears using this otoscope, ma'am. Is it okay for you?
Okay.
Okay, ma'am. Please just stay still, and it will be just fast and not too painful. And while inspecting her ears, you should put your ears up like that. And on the other side. As I can see, her. So next thing we're going to do is testing the client's gross hearing acuity. So ma'am, let's start now with the gross hearing acuity test. During the test, I will stand behind you and I'm going to say a numbers, letters of a sequence and have you repeat it back to me. Like for example, dog. So you will say it again with me, dog. So I want you to cover your ear to the other side. It's not being tested by your pointer finger covering your cranius moving and that in a circular motion. Is that okay, ma'am? Okay, so now let's start. A, F, Z.
A, S, G.
Okay, so I'm gonna cover your other ears, circular motion. Okay, A, F, Z.
A, F, G.
On the other side, E, F, Z.
3, F, G.
Okay, so next is performing the webinar test and conducting the Renee test using the tuning fork. And ma'am, I will put, because I don't have any tuning fork, I will use alternative way. So ma'am, I will put tuning fork with mine at the top of your head and tell me whether you can hear the tune equally in both ears or if it's louder than the other ear. So the next thing to do is the Renee test. I will strike the tuning fork and then put it on the mastoid bone behind your ear and then say now. When you can no longer hear the vibration and then I will move the tuning beside your ear and say now again when you can no longer hear anything. The other side. As a finding, it is considered a positive test or normal finding because the client was able to hear the tuning fork that has sent to their ear persists of approximately twice as long as the sound they heard over the mastoid mastoid process. After the ears and hearing assessment, document the finding right away in the client record. And now let's proceed to the nose and sinuses assessment. So let's start with asking some questions to determine the client's history in assessing the nose. Ma'am, are you experiencing unusual, frequent, or severe colds?
No.
So do you have any allergies or change in sense of smell?
No.
Okay, that's great now. Now let's start with the nose examination, starting in the external nose for any division in shape, size, or color, and flaring or discharge from the nariz. Okay, ma'am. Have a respect. So for finding, it is symmetric and straight, no flaring, uniform in color. Next is palpating the internal nose slightly to determine any areas of tenderness, masses, and displacement of bone and cartilage. I will palpate your nose, ma'am.
Sila nagbalay.
Okay. As I observe, no tenderness, no masses, and displacement of bone and cartilage. Next is determining patency of both nasal activities. Ma'am, as we go on with our nose examination, please close your mouth, and I'm going to exert pressure on one nariz and then breathe through the opposite nariz. Okay. Breathe now. On the other side. Okay, as can be seen, air moves freely as the client breathes through the nariz. Now I will proceed in inspecting the nasal activities using the otoscope or the pen light and nasal speculum. I'm going to observe for the presence of redness, swelling, growth, and discharge. Also, we need to inspect the nasal septum between the nasal chambers. Okay, ma'am. Let's correct your head. I'm going to check your nose. Okay. As seen, mucosa is pink, no lesion, and nasal septum intact, and in the middle with no tenderness. Next is palpating the maxillary and frontal sinuses for tenderness. To assess first in maxillary sinuses, we will use pressure in palpating the cheeks to elicit tenderness. And then for frontal sinuses, I will apply pressure to the forehead above the brow to evaluate frontal sinuses area tenderness. Do you feel any pain, ma'am? On this area, ma'am? As we can see, the client does not feel any discomfort and tenderness. After getting the finding of the nose and facial sinuses assessment, document the client's record. Now let's move on with mouth and oropharynx assessment. Ma'am, is there any problem of your teeth or mouth that you are aware of? Okay. So now I'm going to look at your lips, as I can see a pink, brownish pink, moist lips. As can be observed, the outer lip of the client is brownish pink, smooth texture, moist, soft, and symmetry of the contour. Now please force your lips like this as if you're going to whistle. Okay, that's good. You'll be able to force your lips. Now let me palpate your inner lips a bit and vocal mucosa for color and moisture. And the presence of lesions. Okay. Can you show me your teeth, ma'am? Okay, then open your mouth, ma'am. I'm going to use for the pressure, down the pressure. Okay, open your mouth, ma'am. Okay. So I can see your teeth are white, and I don't see any dental caries. And I was looking at your gums. The gums are pink, and I don't see any evidence of any gum disease. So your vocal mucosa appears moist and pink with no lesions. Now please stick out your tongue so that I can check your tongue surface. Okay, that's good. It is centrally positioned, pink in color, moist and slightly rough. So then please roll your tongue upward and then downward. Upward, downward, side to side now. That's great. You will be able to move your tongue without difficulty and no tenderness. Then please place the tip of your tongue against the roof of your mouth. Okay, that's good. Next, please stick out your tongue again, and I will use the gauze pad to drop the tip of your tongue. Okay. Next, please, I will palpate the back of your tongue with border and base the grade. Okay, thank you so much. As can be seen, no noodles, lumps, or excoriated areas. Also, the salivary duct opening has no swelling or redness. Next is inspecting the hard and soft palate and uvula for position and mobility. So, depressing tongue using tongue depressor. Ma'am, you open your mouth. Okay, as I can see, the soft palate is light pink and smooth, while the hard palate has a more irregular texture. So, ma'am, can you say Okay, that's great, ma'am. The uvula is positioned midline of the soft palate. So next, I'm also looking for the oropharynx and tonsils. Continue to depress the tongue at the same time while using the pen light. Alright, so the throat is normal pink without any lesion. The tonsils are located at each side of the back of the throat. Ma'am, I will elicit your gag reflex and it will be a bit comfortable. Okay, ma'am? Okay. As tested, the gag reflex is present, which is elicited using the tongue depressor. So that would be all for the mouth and oropharynx assessment, and then document the findings in the client record. Now let's proceed to the neck assessment, starting with asking if the client has any history of the following. So have you ever been diagnosed with a medical condition related to your neck, such as thyroid, swallowing issue, ma'am? Have you had any symptoms such as sore throat or swollen lymph nodes, ma'am? Okay, that's great, ma'am. Ma'am, please hold your head erect so that I can check your neck muscles. Okay, as you can see, neck is equal, symmetric, and positioned at the midline without tenderness and flexes easily. Now, please move your chin to your chest, ma'am. Okay, that's good. Then move your head back to make your chin upward, ma'am. That's right. Next is moving your head towards your shoulder, ma'am. Then vice versa, ma'am. Alright. Then please turn your head to the left and right. Okay, that's great, ma'am. As can be observed, the head movement of the client is coordinated, smooth movement with no discomfort. Head laterally flexes, head laterally rotates, and hyperextends. Now, ma'am, please turn your head against the resistance of my hand. Okay. Okay, ma'am. Turn your head, ma'am. Ma'am. Okay. Okay, the other side, ma'am. Okay, that's... I'm going to shrug your shoulder against the resistance of my hand. Okay, ma'am. So, your muscle has an equal strength. Next is palpating your entire neck. And I'm going to I'm looking for the enlarged lymph nodes. Going to palpate your neck. Ma'am, do you feel any pain or tenderness? Alright, that's good. So your lump nodes are non-palpable and non-tender. Then I will palpate the trachea for lateral division. Then I will inspect your thyroid gland. Stand in front of the client to observe the lower half of the neck. Then stand behind the client. Try to swallow. Try to swallow, ma'am. Thank you so much, ma'am. As observed, the thyroid gland is not visible on inspection. Glands ascend but not visible on her. No areas of enlargement, masses, and nodules. After getting the finding, document it right away in the client record. Then let's move forward to the thorax and lung assessment. So, ma'am, do you have any allergy that affects your breathing? Do you have a personal or family history of asthma, tuberculosis, lung cancer, or any lung disease? No, ma'am. Okay. What I'm looking for, the shape and the symmetry of the thorax, posterior and lateral view. Okay, that's good. Your chest is symmetrical. Now, can you please stand up so that I can inspect your spinal alignment, ma'am? Stand up. Okay, inspect the lateral view. Then can you try to bend forward at the waist, and then I'm going to observe from behind the access. Behind the access, the lateral division. Okay, ma'am. Okay, that's great, ma'am. Sit down, ma'am. As what has been observed, the spine is vertically aligned. Spinal column is straight, left and right shoulders and hips are in the same line. Now I'm going to palpate your posterior thorax, ma'am. Do you feel any pain, ma'am, or tenderness? How about the sensation, ma'am? Ma'am, can you try to take a deep breath? Then please say blue moon 4 times, ma'am. Okay. As can be observed, the primitus is symmetrical for the lateral position. The next is percussing the thorax for diaphragmatic excursion. Ma'am, I will percuss your thorax.